Hello, YouTubers. It's Alan. I have a top surgery update for you. First of all, I forgot to calculate the time that it's been before I started the video. Well, let's see, August, September, October, November, almost 4 months post-op top surgery with Dr. Crane and Dr. Satterwhite together in, the North Bay, near San Francisco. So, I'll start with a positive note. Every day I am really happy for having the chest that I do. It just feels so wonderful to walk outside, to go for a walk, to be in public, and to have a chest that feels like me and that I'm not self-conscious about. It's so liberating. It feels really good. I feel like I can stand up tall and stick my chest out, and it just feels great. I feel confident. And there are little things that feel good or exciting, like a few weeks ago I wore a backpack for the first time since surgery, and that felt good because my backpack has one of those little chest straps to like hold it together if you have a heavy load, and I have always imagined what it would feel like to have the chest strap with a male chest, and yeah, it was great. It was nice, so that was fun. And it's so nice to be able to get dressed in the morning, and if I'm not doing anything special, if I'm not going to work, if I'm just going to the store or something, I can just leave on the t-shirt that I wore to bed and don't have to take it off and put something else on underneath and then put the shirt on again. So it's little things like that that are pretty cool. So today, just now, I talked on the phone with Dr. Crane because I had some questions, and I can show you what I mean when I do the reveal. I'm on the ground here, so it's a little awkward, but let me show you my chest. Here we go. Okay, so, I really like the contour, the shape, the placement of the nipples and the incisions. I'm happy with that. And I've been working out, so I'm just happy with the general shape of my chest. So that's what it looks like. Now, if I go closer, I'll bring the camera to me. Sorry if it's shaky. You can see that the scars are pretty thick and raised on the incision and on the nipple part. I hope you can kind of see that or get some sense of it. And the nipples do not really have nipples. Like, there's the areola, but there's not like the raised nipple projection, which is part of why I called Dr. Crane. Because I was like, why are the scars so raised? And why are the nipples really raised with no, like, actual nipple part in the middle? I was like, what the hell? This is not good. And part of why it's disconcerting is that, as I'm going to show you, if I'm just wearing one layer, if it's pressed up against me, you can see, I mean, that does not look like a normal nipple. It's like this huge blob, and you can even see the scar, like the incision. Can you see it here? Yeah, I mean, can you see the incision line even through my shirt? So I was like, that's not cool. What happened? Because I followed all the directions for taking care of it. Granted, I was under a huge amount of stress at the time, but... And I even had the Embrace scar tape on it for the first, like, 5 weeks after my post-op appointment. So I was like, what happened? Did the nipples fall off, or what? So no, the nipples did not fall off. Just in case you want to look at it for reference while I explain what Dr. Crane said to me. Okay, so he was like, oh yeah, you have keloid scarring. On the nipples, and on the incision lines. I was like, oh, awesome. So, keloid scarring is the, like, puffy, raised scarring, like this. This is certainly not as extreme as is possible. If you look up keloid on Google, you can see some very disturbing results that are much more extreme than mine. But anyway, so I asked him what could cause keloid scarring, and he said that it's genetic, and that it's pretty rare for white people of European descent, that only 5 to 10% of Caucasian people are genetically predisposed to keloid scarring. He said it's much more common among people of Asian descent, or Hispanic people, or people of African descent. So I just kind of drew the short straw on that one, I guess. And I'm going to ask my mom about this, because she had a C-section when my brother and I were born, and it does not sound like she had keloid scarring. But anyway, so it's like if you're predisposed to it, there's really nothing you can do as part of the healing process to prevent it. And so I asked him what could be done about it, and he said if I do nothing, over time, as the months go by, the keloid scarring could decrease, it could get bigger, it could stay the same forever. There's no way of predicting that. And if you do want to treat it, there are some options, one of which was mentioned to me by another YouTuber, actually, which is to get injections of steroids, I believe cortisone. That seems like it would hurt. But you can get those injections in the keloid area, which can, like, decrease the body's immune response or healing response in those places. Like, it decreases inflammation, so then the scars chill out and stop being so puffy. But then Dr. Crane said that the steroid injection can make your skin thinner as part of that process of reducing inflammation, and it can inhibit healing, and that means that you can get hypertrophic scarring, which means that because of the skin getting thinner, the scars can get much wider, even though they become flatter. So that would suck to have really wide scars, but I might consider it, because it would be really nice to not have them be so puffy and sticking out so much. He said that, this is uncomfortable, since I am almost 4 months post-op now, I could try getting the steroid injections at any time, like right now, or any time in the future. So I'll think about that. I'm going to think about what I want to do, if anything. And he said that at his office, he or Dr. Satterwhite would do the steroid injections in the scars for free, which is nice, but that it's also possible to get them done at a regular dermatologist or plastic surgeon's office. And he said another option, which does not sound too appealing to me, but in case you're interested, another option is to wait a year and have a scar revision surgery where they would cut out the scar and then sew it up again, doing it differently to have a greater chance of different results, like using different types of sutures, and they would also inject steroids into it at the time of the revision surgery. Not sure what they would do about the nipples in that case, though. I mean, that would not make any sense to cut them out, so maybe they would just do steroid injections into the nipples. And another option is to have a revision where they take the scar out and then sew it up again, but do radiation treatment to that area at the time of the revision, but they can't do that at their office because it takes a special, like, radiation equipment that they don't have. And he said that that radiation treatment at the time of a revision is I think he said 90 to 95% effective at getting rid of the keloid and preventing a future keloid. He also mentioned another possibility, which is to rub in this scar treatment called Medi-Honey. I haven't looked it up yet, but I assume that it's spelled maybe M-E-D-I honey. He said it seemed to work with one patient, but that's the only person he's seen use it. And what else? Oh, he said that if I were to get the scar revision, where they cut out the scar and sew it up again, that anybody who has keloid scarring the first time is somewhat likely to have it again after the revision, I guess, unless you get something like the radiation treatment. And another thing that he said is that since keloid scarring has a genetic component, or is genetic, since it's genetic, if you have keloid scarring at any time for any surgery or whatever, that means you're likely to have keloid scarring for other stuff, like other surgeries. So, he told me if I ever ended up getting lower surgery, that I would be at a high risk for keloid scarring down there, which could lead to things like urethral strictures. That does not sound fun. I imagine that's where your urethra, like, the place where you had the incision thickens and, like, cuts off, like, makes it inflamed or something, so there's not enough room for the pee to go through. That's just my interpretation of this. So, that's good to know that I'm at high risk of that. I mean, since I'm still in the first year of my physical transition, I mean, I'm almost 6 months on T, I am not even dealing with thinking about any lower surgery right now. But good to know. So I think that's really all the information that he gave to me. So, hope you find that helpful. Yeah, so I'm bummed. I'm really disappointed that I have keloid scarring on the incisions as well as the nipples. I mean, that sucks. So I just talked to him right now, so I haven't had a chance to contemplate what I'm going to do about it, if anything. I could imagine that I might try the steroid injections sometime in the somewhat near future. But of course I'll continue to make updates and tell you what I decide. Yeah. I have a cold right now, by the way, so if my voice sounds weird, it's because I have a cold. Anyway, I'll make a 6-month on T video soon. Let me know if you have any other questions. That's it for now. Thank you for watching. Bye.